DTMommyChannel, where we chat all things baby and mommy related. My name is Diane Tulufelamtagati. In this video, we'll be chatting about the third and final trimester of your pregnancy. Now, if you haven't taken the time to watch the first and second trimester videos that I've posted, please do take a look. There's some informative information from there that actually overlap onto this one. So months 7, 8, and 9 are your third trimester. The final countdown to seeing that beautiful baby that you've been baking in there. Now in this trimester, you can expect that the symptoms that you were experiencing in your previous trimester, the second trimester, will be becoming more or even more uncomfortable. They are more severe, probably more frequently, so you do definitely need to monitor them. So you probably are now experiencing some more fetal movement and stronger fetal movement as well. Now, something new within your fetal movement category would be experiencing the fetal hiccups, or hiccoughs is what some people call it. Now, these don't cause discomfort for your baby in or around your uterus. Doesn't just, create discomfort for you. It shouldn't. Now, a tip I can give you is to sit back, relax, and enjoy the cute show, because there isn't much that you can do about your little one doing hiccups. You can hold your breath all you want, but let them pass. It takes a few minutes or maybe an hour or so, and it'll pass. Another symptom or new symptom that you'll be experiencing is some Braxton Hicks contractions. Now for this symptom, I wanted to read out from the What to Expect When You're Expecting book some details around Braxton Hicks contractions. So it says, with delivery right around the corner, your body is warming up for the big day by flexing its muscles, literally. So that's what Braxton Hicks are. This is basically a practice for labor contractions that usually begins sometime after week 20. So that's just a nice summary on what to expect with the Braxton Hicks. It will feel like minor contractions, not like the actual delivery contractions, but it's building up your muscles as well as preparing you for delivery. Please do, again, consult with your doctor, making sure that you guys are monitoring the contractions, making sure that there aren't any negative effects towards the frequency of the contractions or the severity of the pain as well. Now, in addition to the Braxton Hicks contractions, you might be also experiencing occasional sharp or electric shock type of pain. Now, these sensations are felt in the pelvic area. They're commonly known or called lightning crotch, I guess. But this is a symptom that caught me off guard. I think it was my 9-month, like a few weeks before delivery, I started feeling this more. It's very normal, but even in the book, there's not much of a medical term for it or an explanation for it. There are quite few inferences that people have regarding this symptom. It is normal, it is common, and it is assumed that it is your body preparing for delivery, from your muscles and your pelvic area stretching and making room for the big day. A tip I can give you is maybe try moving positions. If you were sitting in a certain position, try moving around, maybe stand up. But there isn't much that you can do about the pain. It is normal and you should just let it pass. I guess it's part of the preparation for delivery. Now, as your belly has gotten bigger, you're getting bigger, heavier. Clumsiness is one of the symptoms that you can look forward to. Now, since the center of your gravity is kind of moving or falling forward because of your belly, you are more prone to falling, which can be also dangerous, right? So you want to ensure that you prevent any accidents of you falling or bumping into something, being more gentle with yourself because you're more clumsy now. A tip would be avoiding wearing slippery socks or slippers or surfaces that are slippery. Try avoid walking on those. Make sure you stay off ladders, get someone to help you if you need to reach for something or pick up something. And also take extra care when walking up and down stairs. Be gentle with yourself. You are carrying precious cargo. Another new symptom would be the colostrum. Colostrum is what you'd be leaking through your nipples or your breasts, and this is that pre-milk substance that would be great for your baby during breastfeeding. Now don't be alarmed, this pre-milk substance might only appear closer to delivery for some mommies out there. It might not be as soon as 7 months. But for me, I do believe at 7-8 months, I was already producing colostrum. I hope I'm saying it right, but yeah, colostrum. A new symptom would be you having lack of bladder control. Now this is due to your uterus. With your baby growing inside of your uterus, there is some pressure applied onto the bladder. A tip I can give is try to ensure that you empty your bladder as completely as possible by leaning forward when you're peeing, making sure you get all that urine out. Do some pelvic floor exercises just to strengthen your muscles as well. Ensure you wear panty liners to help protect from any leakage. And please do continue drinking enough fluids and emptying your bladder as frequently as possible. During your 8 months, you might have your belly button pop. Yes, it could be a protruding belly button. This would be the first time you see the inside of your belly button for some. Well, for me, as much as you wash it, it was so different to see it the way it popped out if you have like an innie like mine. You also might be getting an increase in your appetite or a decrease for some mommies in the appetite. Usually it would be an increase. For me, I experienced an increase in appetite in my last month especially. It felt like the baby was bulking up before leaving, personally for me. So I don't know about you. Did you lose your appetite? Did you gain the most weight at the end? Or did you lose appetite and like slow down a bit waiting for delivery? Let me know, please comment below. Another symptom is having your baby drop. Now that is something you want to happen. You want your baby to drop lower, making it easy, making it ready for delivery. Now a general tip I can give you is coming up with a birth plan. While you're waiting in your last trimester, put together some plans or ideas of what you would like your ideal birthing experience to be. See what's possible or feasible, whether it's with your doctor, hospital, or even your budget. So deciding about little things and letting your partner or family or friends know, whoever's going to be helping you by going to the hospital or taking you to the hospital, knowing when you would like to go to the hospital, like how far along in labor would you like, okay guys, let's go. Think about who you would like to have in the delivery room with you. Personally, I had my mom and my son's father in the room, but when it was time to push and the pain was getting out of hand, I needed him to leave. And it was just my mom and the doctors and nurse, or the doctor and the nurse in the delivery room. I could not stand having Usbusiso in that room because it was just too much for me. Now, you can also decide if you'd like to have pictures or videos taken. Now, for me personally, I asked my mom to make sure that we had the camera set up somewhere and record the whole experience. I'm not visually everywhere, but I love the fact that she put it right there in the corner of the room with a decent view, I guess. But I remember being so annoyed that she kept checking if the camera was on or if it had a good angle. I'm like, leave the camera and come help me, I'm dying. But I love the fact that she kept rolling, kept the camera on. So that is why it's important for you to decide if you want that and let the person who will be controlling the camera or setting that up in place, because you'll be too focused on giving birth to be thinking about the camera. So I'm glad that my mom did take the video at the end, even though I was like, please just leave the camera alone. Some mommies might want to use a mirror. Now the mirror is used by the doctors in view of your birth canal so that you can also see your baby being delivered. Whew, I don't think I would want that ever, but in my birth I didn't go through that. So, you know, maybe it's something you'd like. Would you? Comment below. Also deciding if you'd like the use of IV or painkillers and etc. I do know mommies that intentionally go into the delivery room not wanting any type of medication or painkillers. Girl, good for you. I didn't have much painkillers. I think I had the gas. Was that a painkiller? The gas. Because it really didn't do anything. Instead, it made me like drowsy. Like I felt like I was passing out. Made me dizzy. It didn't take any pain away, guys. Yeah. A natural birth is something else, but it's beautiful. That's all I'll say. It's beautiful still. Now, also deciding what type of birth you'd like, whether it's natural vaginal birth or cesarean. So you need to do some research on what that entails. Maybe I could do a video about the different birth or childbirth options. Maybe I should, right? Thumbs up if you think I should. Now, something to think about in your third trimester is the possibility of having an early baby or an overdue baby. Even though giving birth within your fourth trimester is safe, it's just that your baby might not be fully developed as yet and might need some extra attention. So also kind of having that in mind of what the possibilities are, what your options are in either situations, whether you're having a premature or early baby or your overdue baby. Now, usually overdue babies are induced, but then again, it depends. You need to consult with your doctor. Now, personally for me, I didn't have an overdue baby, but my OBGYN suggested that I be induced at 39 weeks because going with how my body structure was, my weight, just felt as though for me to have a natural birth, I would have to be induced at 39 weeks because the longer you wait, the more prone you'd be to get a cesarean. So it works differently for different people. Our bodies are different, so your doctor can suggest what's best for you, your body, and your growing baby. Emotionally, your emotions are of course changing as you're nearing delivery. You will be experiencing some excitement that your baby is coming soon. You might be experiencing some pregnancy fatigue. Now, I'm not talking about the regular fatigue that we've been experiencing through the first and second trimester. I mean, this is that I'm ready to have this baby out type of fatigue. Now, a very common symptom that mommies experience is nesting. You will be cleaning everything, trying to make sure that the place is perfect for you and your baby, ensuring that you're setting up certain things. I remember trying to put up curtains with my mom and everything, and she was like, no, just calm down, I'll help you. So it's very important to have someone to help you move about certain things, because even though your body is saying, I'm strong enough to move this couch, don't move the couch. So the third trimester is nearing the arrival of that little baby. If you are expecting, good luck and trust your body. Your body knows what it's doing. It was born to do what it's about to do. Trust whoever you believe in. I believe in God, so pray on it as well and just have happy, positive thoughts. You're doing good, you're doing great, and you're doing the best you can. I hope this video was informative. Thank you so much for watching. Until next time, bye.